Despite the warnings, melanoma is now the second most common form of cancer in females ages 15 to 29. Welcome back to Western Mass News at 4:30. I'm Beth Ward.
And I'm Dave Mattson. All that according to the American Academy of Dermatology. Now, a doctor in Omaha is speaking out, saying the incidence of millennials diagnosed with melanoma in her office is alarming.
We talked with a local dermatologist today to find out if the same holds true here in Western Mass. Sun-worshipping millennials have prompted a dermatologist in Omaha to sound the alarm for people to get into a doctor's office to get their skin checked, saying their office is now routinely diagnosing skin cancers in millennials and younger. New England Dermatology and Laser Center's Dr. Stanley Glazer says the number of younger patients coming in here is growing.
My take on that is that I think millennials or the younger generation, they're very aware of sun exposure, and they're probably seeking attention much earlier than they would have or the previous generations did, and therefore we're seeing probably more skin cancer in that age group.
Millennials, he finds, are becoming more sun aware. A millennial defined as anyone born between 1981 and 1996, so about 23 to 38 years old today.
I think a lot of that age group has unfortunately been in too much tanning in the tanning booths and things like that. And that does definitely accelerate things developing. It accelerates the development of skin cancer. It accelerates photoaging. It accelerates a lot of things. And I think there's a lot of so-called buyer's remorse.
He says the tanning booth trend persists.
It's beyond me. It really isn't. I don't understand it because the warnings are on the machines, but I do think the luster's wearing off a little bit.
Dr. Glazer tells Western Mass News he finds younger patients are starting to recognize the sun mistakes of their parents' past in the form of wrinkles or, even worse, cancer.
People are much more conscious about their appearance, and there's no reason why they shouldn't at least have an initial visit with the dermatologist.
Barring covering up, this, he says, is the best defense. Mineral-based sunblock like zinc or titanium that stays on the skin longer and protects better. One more reason to put that sunblock on. It's estimated by the American Cancer Society about 96,000 new melanoma cases will be diagnosed this year alone.